Hi, Gary DeSmith from Allegiant Physical Therapy in Durham, New Hampshire. Today we're talking about shoulder pain, very common type of problem. Typically with this kind of situation, people are complaining of pain on the outside of the shoulder, many times the front part of the shoulder, and they'll feel this especially with reaching. Reaching overhead, reaching sideways, sometimes reaching behind their back or behind their head or neck, and the pain can be sharp at times. Many times they won't feel anything, but it's only with reaching in a certain direction that they might feel it. Many times with this type of problem you can have night pain as well, which is a function of the wear and tear that builds up through the day. So it can be a reaching problem. Sometimes, again, there's a sleep disturbance involved with this. And the goal in physical therapy in dealing with this is establishing what the root causes of the problem are and then addressing all of those factors to try to gradually work the shoulder back into functioning more normally and moving more normally, and therefore causing less irritation. So let's take a look at what's going on. This is a diagram of the shoulder here. So this is the front part of a right shoulder. This would be the shoulder blade, which includes the socket. And we know that the shoulder joint is a ball and socket type joint. So the socket is part of the shoulder blade. And this is the upper arm bone. So this is the ball and the upper arm bone coming back down here. So if we look in the shoulder joint itself, there's also a ligament that's located right here, the dotted line. And this bone sticking out here, the acromion, is actually the top part of the shoulder blade. So this makes up the socket part of the joint, all of these factors, the bone, the ligament, and there's also some cartilage here. That makes up the socket of the shoulder joint. In between the ball and the socket, you have your rotator cuff tendon, and there's also bursa material in there. And this is painted in orange here because this many times is the source of the pain. What can be going on with the shoulder when you're reaching, if it's not moving right, you wind up with rubbing and pinching between the ball and the socket, and it's these softer tissues that get affected, and that results in your pain. And it's also why you only hurt when you move in certain directions, because it has to be one of those directions that actually causes that tissue inside the shoulder joint to be pinched, okay? So looking at some of the causes for this, the first one is a key one, and that is posture. So the more slumped we are or slouched through our upper body, the more chance there is for that pinching and rubbing to take place. And what happens with, if that posturing goes on for a long period of time, it throws things out of balance. So when I say things, essentially what I mean is the flexibility in the shoulder as well as the strength. So you wind up with a lack of balance. So you get tight on one side of the joint and loose on the other. You get weak on one side of the joint and strong on the other. Everything gets thrown out of balance. And there's a coordination issue here. When things get out of balance, then those muscles start working the wrong way. They're firing at different times, at wrong times, and mechanically, your shoulder isn't moving or working properly any longer, and you lose that coordination that you normally would have. So what can we do about that? Well, posturally, we need to really take a good close look at the shoulder blade, because that's the foundation or the anchor for the shoulder. So we need to work on getting you nice and tall and training that shoulder blade up. That's the key, making that nice and stable. Creating a rebalanced situation in the shoulder where things that are too tight, getting those loosened up gradually, and muscles that are too weak, that are not firing, we got to get those going. And that leads to the third factor, and that's re-educating the muscles. There are certain key muscles in the shoulder that really need to work properly together, and most specifically shoulder blade muscles and your rotator cuff muscles. Your shoulder blade muscles and rotator cuff muscles need to work well together in order for this rubbing and pinching to not be taking place. So that's a little bit about how we approach this shoulder pain, or sometimes called shoulder impingement type problem, in order to naturally try to bring about healing. But these are root causes that need to be addressed before this can work properly. Certainly medications and these different things can have an effect, but it's these root causes that really need to be addressed. So I hope this helps you understand what that's all about. Thank you for watching. My name is Gary from Allegiant Physical Therapy in Durham, New Hampshire. If you appreciate this video, please like it and subscribe to our page, and definitely leave us a comment down below. And thanks for watching.